Yesterday, the state gave $500,000 to the University of Kentucky's Markey Cancer Foundation to support cancer research and assist families. And some of those families were there to hear the good news. Details in tonight's look at Medical News.
We are here to celebrate the children who are here, the children whose pictures are behind me, and to let you know that even if your loved one isn't here today, they're still loved and they are missed. Andy and I believe healthcare is a basic human right. It is our responsibility to prioritize our children. That's why Kentucky is punching above our weight in the battle against pediatric cancer. To give you an idea, the federal Gabriella Miller Kids First Research Act designates $12.6 million per year for childhood cancer research funding. That's amazing, but it's not enough. That's why last year in our biennial budget, Kentucky designated $10 million in state funding for childhood cancer research. In addition to funding for research, we designated $4 million to directly support children fighting cancer and their families. Kentucky is putting these brave kids first, which is exactly how it should be.
Imagine what you would feel as a parent when your fifth grader, 10-year-old son says to you, "Is this the life I'm gonna live? I would rather die." It was determined that Daniel had acute lymphoblastic leukemia, which is otherwise known as ALL. It was shocking and heartbreaking. To our surprise, a day after he started his chemo treatment, he was able to move his legs, even walk to the bathroom, and that was our first sign of hope. We knew we were in good hands. Daniel's 2.5 years battle with leukemia started with this hope, but it was never an easy one. We were able to go through it because of the support we've received from the state, from this hospital, from the doctors, nurses.
I'm not only here today as the majority floor leader of the Kentucky State Senate, I'm here today as a cancer dad. And my son's 6 months of age was diagnosed with stage 4 neuroblastoma cancer. Traveled with our son, we went through 14 rounds of chemo, about 6 surgeries. And we knew the prognosis. We knew when you get into percentages and numbers such as that, that's never anything that you wish to have your child be put with a percentage of what their life expectancy could be. And typically in your first session, you just kind of sit back as a legislator. You kind of wait and understand the lay of the land and how things are going to be. But I always knew that one of the things that I wanted to make sure that I did, no matter how long I would serve in office, is remembering back to those who helped my child. So we were very blessed in my first session to have passed Senate Bill 82, creating the Pediatric Cancer Research Trust Fund Board. We have now seen $36.5 million go towards pediatric cancer research dollars, investments here. And I want to thank the University of Kentucky, the whole healthcare community here that is collaborating also with the University of Louisville. We may have battles on a football field or a basketball court, but not when it comes to our children.
The First Lady also presented a proclamation from the governor's office for Childhood Cancer Awareness Month.